ARFH is the principal recipient for tuberculosis under the Global Fund grants to Nigeria. And ARFH, as an indigenous non-governmental not-for-profit organization, works with the National TB and Leprosy Control Program. ARFH receives the grants and has sub-recipients. The program itself, is aimed at diagnosis, prevention, and treatment of positive cases for TB.
The prevalence survey that we had in 2012 indicated that we had so much of TB cases within the community that are not being notified. So we thought as a program that we should find them actively by going from house to house to search for those cases. And that is why the name Active Case Finding. And we are implementing the intervention in 21 states. We selected the priority states where the report shows that we have those cases, and we are doing that intensively.
We have 20 local governments in the state, but only 5 are doing active case search. By 2015, the cases we registered was not up to 3,000. It was 2,646 thereabout. That was the cases we registered in 2015. But in 2016, we registered 3,240 cases. And that is an increment of almost 600 TB cases. This is due to support of Global Fund.
Today's activity is about coming to do on-site verification of the active case search in Bauchi State. Here we are now in Tafawa Balewa local government. We are in front of General Hospital Tafawa Balewa, where we have come to meet the CBO in charge of the local government, John Somida. They are the ones covering 23 slums in this local government.
So ARFH is the principal recipient, then the TB network are the one we are reporting to them. We carried out active case search in the local government. We have 10 CTWs. We are working in 23 slums, that is 23 communities with 10 CTWs. We are doing house-to-house search on TB. From April to December 2016 last year, we fetch out 40 patients, that is semi-positive cases, 40. Then from January to June this year, 2017, we fetch out 42 patients. And all of them are on drugs.
I've been taking my drugs here each and every month. They used to test and see. It's not our wish to be affected with. And since they take care of us, I want to say thank you and may God bless them.
For me, it's okay. I just wanted to know.
Yeah, that is why it's one of the slums.
Yes, I agree. We have just looked at interviewed them, looked at their data, and we are going to the field now to see the CTWs working.
I do house-to-house searching. I get patients. For now, I have almost about 10 patients that are positive. I have about 30, more than 30 that they are presumptive patients for TB. We have been getting patients, and some they have been well now. So what I will encourage them, if they would like, they should extend the program to about some years, so that we continue to search, because there is some in the village that they are coughing, so we need to search them more.
Because of the stigma, people are still reluctant sometimes to come forward. even though treatment is available free of charge. So a door-to-door approach, I think, is going to be more effective.
ARFH has these stores, 6 zonal stores. So we get from Oshodi, we do distribution to the 6 zonal stores in each of the zones from the state to all the facilities in the country. So it is the responsibility of ARFH to make sure the drug gets to the facility, and from there the facilities, they issue the drugs to the patient.
The CBOs in the states have been supporting the laboratories to function because most of those labs have infrastructural gaps. Some of them don't have workbench to work with. Some of them have water issues. There is no power supply in most of those labs. So the CBOs have been able to provide generators, some even dug wells, so that they can have water to run the samples, and so many other successes like that.
Form 1 was established in 1986. Form 1 Form 1 generally is an umbrella organization of Muslim women's organization in Nigeria. We have our national body situated at Abuja. We divided the CTWs into 5 groups, a group of male and a female. From February 2016 to December 2016, we have detected 70 cases, 70 TB cases. And from January to June 2017, we have detected 64 cases.
We go house by house, like asking people like if there is anybody that has been coughing for 2 weeks or more than that, they will collect the sample of his sputum for test. And after the test is done, if he happens to be TB positive, we take him to the doctor's office for treatment. And if he's negative, fine. At least he has learned his position and his cough is not dangerous. That will harm him and people around him.
We are working with tracking form. That's taking of the information of every household, name and address, age, sex, and the number of the people in the house.
I was having cough for more than 4 months. I was sweating every night, and I was losing weight, and I was so tired every day. When the community health TB workers came to my house, they collected my sputum sample and took it to the hospital for tests. And when they came back, they said I have TB. And they took me to the DOTS officer who was giving me drugs. I was taking my drugs, and I started feeling better. When I was suffering from this cough, I was so tired I couldn't do my business anymore every other day. But now, I have finished taking my drugs for 6 months. They tested me and said I no longer have TB. And now I'm stronger to do my business.
We're working through community structures, that will facilitate entry into disadvantaged communities. There are communities that are high risk, for tuberculosis because of the poverty level of their lifestyle and the environment where they live. So we're targeting those in selected states.
Global Fund, the ARFH, the TB network, they do well. We thank for the things that you do.
In Warawa LG of Kano State, if not for the intervention, they would not have reported any TB case because all their positive cases placed on treatment came from the active case finding intervention.
It's really yielding a positive result because in some local governments where the intervention is happening, you see that they are contributing up to 20% of the total TB case finding within that local government. In some local government, they are even contributing up to 80%.
So many other LGAs in the state also reported a lot of cases as against what they were reporting in the past because the intervention brought a lot more cases than what they would normally report. So these are some of the positive stories.
In 2015, the total case notified in those 4 local governments were 785. But by 2016, when we started the active case search, at the end of that year, the case notified from these 4 local governments was 1,071. Now that gives us a difference of 286. And that is almost 36.4% increase in the active case search. Yes, so I think that could be attributed to the active case search in those local governments. And the statistics from these 4 local governments so far is showing that they have registered 590 cases in 2 quarters, as against in the last 2 quarters of 2016, which they registered 535.
For the active case oversight conducted to Bauchi State, we have come to Ningi Community Development Initiative, one of the organization that is in charge of the active case finding in this local government. We have gone to the field. That was the first activity we did, to see the CTWs at work, going from house to house. Thereafter, we saw one patient in the community that had been cured and was interviewed, who gave satisfactory report about the treatment she received.
Global Fund has been giving us tremendous support on TB. The support is dated back to 2004. Currently, they've been providing support for us based on a work plan that was developed in country, and that was also agreed upon by all stakeholders. The support that is being provided is for the patients, and they also support us at the national to ensure that we have our oversight function, our coordinating role is done appropriately. They provide drugs for the first line drugs for treating drugs that do TB, and then that is through the half, and the essence is that at the end of the day we have a good treatment outcome. That is, a lot of these patients get cured. That is the ultimate goal.
What impressed me most was that they were marking the houses. Each house had a mark, had a number. So they were marking the houses, and that is how they were being able to be doing house-to-house case search.
Also, we went to the General Hospital Ningi, where we went to the DOTS facility there.
They come and give me drugs and help me, so I'm very happy. I'm very happy.
Thank God I have been already operating this gene expert machine, no problem. So if there is positive during I finish my analysis, the machine is showing if there is positive, I see positive inside. But if it is not positive, so the result is showing me it's negative.
We checked through the data from the presumptive TB register to the TB register. The data got from these 2 registers were corroborated with that in the LGA register and the community register that is used by the CBO.
The support that comes through ARFH, I think it's a good one, and it has helped us generally in the overall performance of the state.
Through these activities, some patients that don't know where to access the services access these services through our organization, and then other people as well is aware of these signs and symptoms of TB. So it's a very good exercise. If it is going to be exceeded for some years to come, I'm sure more people are going to be cured of TB diseases.
We appreciate their support. The federal government appreciates their support. They are contributing to ensuring that we have a good response in country, and then be able to find the cases where they are, put them on treatment early, and interrupt the transmission of TB in the general population.